Unfortunately, for decades, federal dollars has promoted low-quality, highly processed foods that lead to scores of long-term health issues, which means Americans have gone broke because of these health issues. Faulty dietary guidelines of the past stacked the deck against healthy eating and food options for everyday American families, which has fueled the chronic disease epidemic and jacked up the healthcare costs of households across the country. This failed approach in our public health system ends today.
The new guidelines recognize that whole, nutrient-dense food is the most effective path to better health and lower healthcare costs. Protein and healthy fats are essential and were wrongly discouraged in prior dietary guidelines. We are ending the war on saturated fats. Diets rich in vegetables and fruits reduce disease risk more effectively than many drugs. Whole grains outperform refined carbohydrates. Added sugars, especially sugar-sweetened beverages, drive metabolic disease, and today our government declares war on added sugar. Highly processed foods loaded with additives, added sugar, and excess salt damage health and should be avoided. As Secretary of Health and Human Services, my message is clear: eat real food.
So alcohol is a social lubricant that brings people together. In the best case scenario, I don't think you should drink alcohol, but it does allow people an excuse to bond and socialize, and there's probably nothing healthier than having a good time with friends in a safe way. If you look at the blue zones, for example, around the world where people live the longest, alcohol is sometimes part of their diet. Again, it's small amounts, taken very judiciously, and usually in a celebratory fashion. So there is alcohol on these dietary guidelines, but the implication is don't have it for breakfast. Right? This should be something done a small amount with hopefully some kind of an event that might have alcohol added. But the general move away from 2 glasses of men, 1 glass of women, there was never really good data to support that quantity of alcohol consumption. What the president has done overall to increase the affordability of healthcare. The biggest accomplishment perhaps for the health system ability to drop down prices last year was the most favored nation drug pricing that Caroline mentioned. These are incredibly effective at reducing the costs, for example, of what the president calls the fat shot, the Ozempic, GLP-1 category of medications. We dropped them dramatically. But the best way to reduce drug spend in America is to not need the drugs in the first place.